Well, welcome to the end of day 2 of AHA Scientific Sessions. I'm Amit Khera, Vice Chair of the Committee on Scientific Sessions Programming, joined again by Manesh Patel, the Chair of the CSSP. And Manesh, another great day. Well, tell us about the presidential session. How can we forget to talk about that?
I know, the AHA does so many things, but one of the things the AHA does when you're here is it hopefully inspires you to make a difference. And if you weren't inspired by sitting in the audience when Michelle Albrecht gave that talk about all the things we can do and the effect of not just what's adversity, what's the biology of adversity, and then what are the things you can do whether you're a clinician, a researcher, you don't even have to be in medicine. So I thought it was one of the more powerful ones. Every year when I come to them, I'm blown away. So I thought it was fantastic. There was music, there's dancing, there's the impact we can have on human health. So I thought it was really wonderful. And I hope if you haven't seen it, it's on demand and people get a chance to see it. It is one of those things that I think will leave a lasting impression on what the next 100 years of what the AHA is trying to do.
I couldn't agree more, and I think that whole point about the biology of adversity and just it talks about her research and her journey, and really her passion was clear, and she's right, she gave us marching orders. At the end of the day, the other thing we do is go over late breakers. So the first late breaker today, surgery and interventional, what did you see there?
Yeah, I will tell you that it is about the science. It's the science bringing it to life, and I would say that the first late breaker was interventional, and we learned some things, and we confirmed some things. So one of the first studies we saw was the 15-year outcomes of the radial artery grafts versus right internal thoracic. Others still a benefit out to 15 years and should be done, if possible, in cardiothoracic surgery patients. I thought that was important. And a randomized trial in ECMO. We have patients in shock. We know as a group we need to get better evidence there. The AHA is working on a shock registry with a group of people that are hopefully helping us get into the hospitals. The ECMO shock trial told us today, a few hundred patients, randomizing patients to immediate ECMO versus usual care. There was a crossover, a significant number of patients crossing over, 20, 30 patients. Unfortunately, that's going to happen. It's a strategy trial, and at 30 days, no difference in mortality, although early on looked like ECMO is helping. So, the questions about candidacy, what other therapies, they'll continue to happen, but the good news is we're getting science there.
Yeah.
Well, how about some of the other late breakers? You were involved in some of the ones around prevention, I know. Tell me what was interesting there.
Yeah, again, great day for prevention. I'll start with hypertension. We had follow-up to last year, the Village Doctor study, 30,000 individuals randomized to usual care versus a Village Doctor intervention. Last year we saw substantial reductions in blood pressure, and this year we saw improvements in cardiovascular outcomes. And as we look for new strategies for hypertension treatment and management, this is really a blueprint maybe for many areas in the world. We also saw in the same session, you go from 32,000 people to 200 people, a mindfulness-based intervention, 5 millimeters of mercury, 5 to 6 in systolic blood pressure, that's meaningful. That's almost as much as one medication, and seemed to improve lifestyle habits. So, we're seeing new strategies in terms of treatment of blood pressure, and it's a great way to start the prevention part. Now I'm going to come back to you here.
Oh, okay.
We did have some TCT sessions, and we also had another late breaker this afternoon with some more interventional therapies.
Yeah, no, I would say, just like you told us, we see the spectrum in the preventions. You said, wow, look, we got all the way from Village Doctors to mindfulness. That's sort of going on in other parts too. I would say the TCT sessions here have been fantastic. TCT at AHA today had case theater, had a couple of case theaters, both coronary and peripheral. I think the peripheral one was fantastic because, again, it gets patients with critical limb ischemia, went through what the decision making is, a little bit of what are those features, and it got us ready for tomorrow where we're going to hear about BEST CLI, a randomized trial in those types of patients. So I thought that was really powerful. And then we did have some more ischemic and sort of interventional types of studies. Two things that sort of stood out in that session. I think Dr. Stone presented the bivalrudin data for a randomized, well-powered study, and without GP2B3A inhibitor, it does look like bivalrudin had an effect on this cardiovascular. So I think that's a powerful message. And then ischemia extended follow-up. We're going to continue to follow this story out to about 6 years, not all the way out to 10. Looks like the mortality was the same. Cardiovascular mortality starts to trend towards better, actually statistically better, but non-cardiovascular doesn't. So I have to understand why that happens. People with cancer deaths when they're also potentially getting cardiovascular benefits. So trying to understand that. And all told, no difference in mortality. Yeah. So pretty interesting. Anything else you saw that was good today?
Well, first I want to say with your studies, it just tells us the conversation's ongoing, right? So we're going to continue the conversation. I was fortunate to moderate a late breaker just now, and I have to say, if you're a lipid person, this is where you needed to be. Another EPA study, this time out of Japan, technically negative, although there was a trend towards some improvement. So Again, more controversy, more discussion. We had the Oceana dose study, LPA inhibitor every 12 weeks, 95% reduction in LPA levels in New England Journal today. EMPA kidney, of course, we had it at ASN, we had it here. Really impressive in terms of improving chronic kidney disease as well as cardiovascular outcomes with a meta-analysis that's in Lancet today. And then to finish it off, 200-person trial, but it was statin versus 6 other supplements, and none of the supplements lowered LDL, but statin, modestly and markedly did. So really important information for physicians as we counsel patients. But I
got to tell you, that last study got my attention. You were telling me about it. I know I'm going to go home and tell my mom turmeric doesn't lower your LDL. And that's going to be a message everybody's going to need to hear. Garlic's not changing it.
That's right.
But the statin is tolerated. Do take the statin. So those are important messages.
So what's tomorrow, Manesh? Tell us about tomorrow.
So last day, but hopefully best day, right? Yeah. We're having great days every day. So just tune in tomorrow. Hopefully you're going to be there. But what you're going to get to see is best CLI, the randomized session I get to moderate in the morning. So I'm excited about that. It's going to have what we call, preventing problems with your limbs, arteries and veins. What can we do to help? And so there's both the best CLI randomized trial looking at critical limb ischemia, and it's going to be both the outcomes and the quality of life are going to be presented. And then 2 studies on, how do we get therapies that we know might work, venous thromboembolism therapies, prevention therapies in patients that are medically ill, or in COVID, did it help? So we're going to get to see that. And my EP colleagues, lots of heart rhythm stuff coming still tomorrow, so we're going to do that. And then a wrap up. And the heart rhythm stuff's going to have some good stories around, do you do intervention first or treat with the antiarrhythmics? How about some intranasal etrapamil for people with SVT? So lots of great science again at AHA, but part of it's just being here with friends and colleagues. So we hope you all are enjoying these daily recaps, and we look forward to seeing you here again tomorrow for our last one. And for everyone here, we're excited to get the science back to you.